Lauren, I believe it was the Washington Post that had the headline of the third world collapsing on virus and the U.S. How did we get here culturally? You as an emergency room expert, how did we get to the point of medical arrogance in the United States?
It's a great question. I think one that me and my colleagues are asking a lot of ourselves these days. I think one of the things that has come readily apparent is that it's hard to remind people to pay for preparedness. When you do preparedness well, it kind of looks like you're not doing anything. And when you do preparedness poorly, it definitely looks like you haven't done anything. So that constant reminder that we need to invest in public health preparedness infrastructure has by the wayside, and I think this is the aftermath of that, and we really need to start from scratch and build up our public health infrastructure, especially our public health IT infrastructure now.
To your wheelhouse, in an emergency room in Miami, Florida, in Phoenix, Arizona, at Dr. Hotez's Baylor in Texas, what's the difference in the cases to death dynamic now versus the cases to death dynamic in New York of 3 and 4 months ago? What have we learned? What's better?
What's better is how we manage these patients, for sure. We do have remdesivir, which is a important tool in our toolkit. We've learned so much more about how this virus works, how you manage these patients, how you manage the hypoxia, and how you move them through the hospital system. The infection to death dynamic is changing, and with the reopenings that we've seen across the country, we're seeing a lagging death rate. So while right this second it might look like the death rate is lower, we're already starting to see it creep up and follow that increased case and transmission dynamic rate.
Lauren, do you think there is a growing sense in the United States that there will be a vaccine? That vaccine will come soon. We've had news out of Moderna this morning in terms of the trials that they are doing, and it looks like we're going to get news in the Lancet fairly shortly on the Oxford vaccine as well. Both seem to be progressing quite quickly. Is that creating a false sense of safety, do you think?
I'm not sure if it's creating a false sense of safety. Possibly early, when people are seeing the news, they're starting to relax and thinking that a vaccine may come soon. I think it is creating a bit of excitement, and we still have a long way to go in both of those vaccines. The Moderna news that 45 people produced neutralizing antibodies is very exciting, but it was phase 1 data, and there's a long way to go before you complete a phase 3 trial and get the vaccine broadly to the public. Those are two of approximately 150 vaccine candidates that are out there. So I think everyone thinks that we're going to have a vaccine for this. What that means and how often you have to get that vaccine, does it look like a one-time vaccine? Does it look like the flu vaccine that you have to get every year? We're still waiting to see how long people maintain those neutralizing antibodies, how long immunity is conferred. And so I think there's cautious optimism is what I would say. But certainly it does not mean that right now people should be relaxing all those other things that we remind them to do every day, like wear your face covering and physically distance from people when you don't have to be close.
Lauren, you talked about preparing for the worst. Let's talk about what happens in the fall. Particularly in the Northeast, where you will not be able to kind of eat outside al fresco as you are now and drink outside in the same way. What kind of an experience are you anticipating kind of October, November? Is there going to be a second wave? What are you expecting and what are you preparing for?
Yeah, I'm not actually convinced that we're out of the first wave here. In the U.S., I think we have a long way to go to control cases before we can even start to think about the second wave. And I am very concerned for the fall and winter, not just for people's lifestyles, because I think it's an important point that you raised. These businesses may not be able to sustain the same level of activity in the fall and winter when they can't make use of outside spaces, but also that fall and winter is when we see flu cases. And while, the physical distancing that we're taking, while all of that activity, all of these public health measures may reduce some of the flu burden, it's still going to be there. And we're still going to see cases of flu and COVID at the same time. And we could see these increasing cases that we're having now mixing with flu. And that creates an enormous challenge for our emergency departments, for our hospitals and health systems, not just separating who has flu and who has COVID and maybe even who has both, but managing the volume of the flu patients along with this new volume of or renewed volume of COVID cases. It'll be a real challenge for sure.